During an asthma attack, the muscles of the lower airways go into spasms and constrict. This narrows the airway and reduces the flow of oxygen into the lungs and causes shortness of breath. In addition, mucus plugs form in the lower airways, further inhibiting the ability of the body to oxygenate the blood. The incidence of acute asthma is increasing, especially in urban populations. Approximately 20 million Americans suffer from asthma, according to the World Health Organization. Someone who is experiencing an emergency asthma attack will typically be sitting up in the tripod position, where they are leaning forward. They'll have obvious breathing distress that is evidenced by excessive muscle use around the ribs. Other indications include difficulty in talking, distress and anxiety, a dry, unproductive cough, possible loss of consciousness. Many victims with asthma take a prescribed bronchodilator medication and can self-administer it. First aiders may assist the victim in using bronchodilator medication under the following conditions. The victim states that he or she is having an asthma attack or symptoms associated with a previously diagnosed breathing disorder, and the victim has the prescribed medications or inhaler in his or her possession. The victim identifies the medication and is unable to administer it without assistance. Utilize the acronym AID. First aiders should be familiar with how to use an inhaler. Remove the cap from the MDI, metered dose inhaler, and shake well. The person should breathe out all the air in their lungs. Then the mouthpiece of the inhaler should be placed between the teeth and their lips sealed tightly around it. The victim should breathe in slowly, pressing down on the canister one time. Encourage the victim to continue breathing in as slowly and deeply as possible. It should take about 5 to 7 seconds for an inward breath. In order to allow the medication to reach the airways of the lung, the breath should be held in for at least 10 seconds. Count to 10 slowly. Repeat the above steps for each puff ordered by the doctor. Wait about 1 minute between puffs. Replace the cap on the MDI when finished. An ambulance should be called in the following circumstances. The medication is not working after 5 minutes. The condition is getting worse. Talking is becoming more difficult. They start to become exhausted. Continually assess the victim. If a victim is suffering an asthma attack and does not have an inhaler, utilize the acronym AID. Sit them down, ideally leaning them slightly forward. Encourage them to relax and let them know help is on the way. Have them slowly inhale and exhale using perched lips. Inhale through the nose and exhale through the mouth, similar to blowing out a candle. Loosen tight clothing. Oxygen should be provided to all victims with severe asthma.